Well, it is so important. I am a physician, and for the last 15 years, I have been propagating the use of information technology. Medicine is a highly information intensive discipline. A good physician has to remember 2 million facts. So the human brain is not able to store all these facts. So we rely on information communication technology to maintain our quality, and that's why we are interested. And this e-health is a very good platform, and many new ideas have come, like mobile. Now today there are more mobiles in the villages than latrines, so we use to our good advantage. The mobile can be used as an instrument for spreading health message. So this is a great revolution that I am looking forward, and that's why the importance of such events.
How do you think ICT can be a universal equalizer in delivering better healthcare?
As you see, the villager cannot go to a hospital very easily. But if he has a mobile, I can give him information. For instance, if you are having fever, I say take 4 tablets of chloroquine for malaria. So such advice can be given, and this will save immunization advice. If you got a new child born, I will remind him, get the polio vaccine, get the measles vaccine. So constant reminders and health messages. Also important negative things. Stop smoking, stop alcohol, take more fruits and vegetables. So health messages can be given in the patient's own language while he is using the thing. So it's a great instrument of promoting health care. And there was a talk today that in rural areas, e-health has been promoted through mobiles. It's a great revolution. Now, one good thing is that information technology has become available and affordable. In rural areas, if there is no electricity, now a solar battery operated option is very interesting. So there may be no electricity, but a solar cell can support your information technology equipment, which is a very encouraging sign. And I feel that the rural-urban divide can be very much narrowed by the use of information communication technology. And India is fortunate. We have got a satellite which is only for instruction. So we are better off than many other countries to disseminate knowledge through ICT, because we have got dedicated satellites. ISRO is a dedicated satellite for education. So education and health are going to be impacted by ICT, and some of the best brains in ICT are Indians. We Indians are making computer programs for hospitals in Europe and America, but our own hospitals are not getting the benefit because of lack of resources. So time has come where even the rural areas can get the benefit, and we should be very optimistic about it. You asked a very important question. One of the major areas of internet is patient education. Do you know the commonest site for internet is pornography. Next site is health, and women are more using the internet than men. So 40% of internet access is patients seeking health information. So that's a very encouraging sign. Today if I prescribe a drug to a patient, she goes to the internet and she tells me, sir, you prescribe this thing, but the internet is telling me this is better. So she's putting me on alert. So I am telling today the doctor should know as much as their patients know through the internet. And health insurance is a very good idea, and it should be made affordable. And I would add preventive care. A simple thing, if you exercise for 30 minutes every day, if you lose your 5 pounds weight and reduce your abdominal girth, if you stop smoking and alcohol, these are messages for positive health. So health education should be emphasized as vigorously as treatment. And our ancient Ayurveda puts emphasis on promotion of positive health and prevention. So the entire education should emphasize on prevention of disease and promotion of positive health. If you see the statistics, Indians have provided most of the medical service in Britain and in the United States. There was one statement that if America was to produce medical colleges, to produce doctors, which now they are importing from India, that expenditure should be much more than the help that Americans give to India. So we exporting doctors were helping America. The British medical health service is run by Indians. So the paradox is 80% of the product of All India Institute, our best institution, is for export. But they are doing well in America. The Indian doctors abroad are doing well. So what I say, don't be guilty that you are going to America. Bring your knowledge to our benefit. Come 1 month in a year, do our operations, do your... So many of the doctors who are in America, they come once a year and they give the benefit of their expertise. So that is also one way of repaying the loan that you are... But it's true that we need more doctors in India, and unless the rural setting changes, but now quality of life in rural areas is much better. With dish antenna, a doctor is not cut off. I did rural service for 5 years in 1950. At that time I was isolated. Today in a rural area also, you can have internet and this, so the quality of life in rural area is much better. No pollution and no... So we should encourage people to go there. But doctors must accept their moral responsibility. If we accept our moral responsibility, then facilities can be created. A missionary doctor comes to India. He goes to a village, but the mission takes care. They give him an air conditioner, they give him a refrigerator. So I'm not underestimating his missionary spirit, but if you provide enough infrastructure for the doctors, education for their children, doctors will go to villages. But they have to go there.
Have you been using ICT and other technologies in your hospital?
Yes, yes.
What are the...
I was the first person in India to write a book called Computers in Medicine, 1997. Then my second book is Computers in Medicine, Progress in Medical Informatics. So I believe that computer is a good educator. In a medical college, most people enter with 95% marks. The reserve class comes with 40%. It is my belief that computer education tools with repeated learning techniques, drill and practice, will bring up that 40% to the level of 90%. So the computer is a great liberator. So people who are disadvantaged can be given more emphasis through computerized education. And my feeling is, if you use computers as educators, there will be no failures. You are a smart student, you pick up in 1 session. I am a dull boy, I pick up in 10 sessions, but at the end of 10 sessions, I am equal to you. So in my view, in future, computerized instructions and computerized self-evaluation will eliminate the need for examinations, and there will be no failures. That is the ultimate goal.
That will be done. Thank you.
Okay, thank you.